Welcome back to New Day Northwest. Almost every industry out there has been impacted by COVID in some form or fashion. One most heavily hit by the pandemic has been our local hospitals. Here with more on that is Mary Shepler, Chief Nursing Officer at EvergreenHealth, along with Beth Zborowski with the Washington State Hospital Association. Thank you both for being here. So Beth, let's start with you. Tell us what impacts Washington hospitals are seeing now that we're 2 years into the COVID pandemic.
Yeah, so we're still seeing COVID in the hospitals, but as you know, hospitals are the only place where you can go for emergency care and specialized surgical services and really life-saving healthcare needs. But right now we are having a problem with capacity where people are getting stuck in our hospitals. Many of the hospitals are operating at 120 or 130% of capacity. Some of that is COVID, but a lot of it is people who are ready to discharge, who are not able to find spots in nursing homes or adult family homes that need additional care. They can't go home, but they're ready to leave the hospital, and they're just getting stuck there because of underfunding from the state and from you know, the issue of the pandemic just keeping people from staffing those facilities as well. So
this trickle-down effect.
Yeah,
I had no idea. Wow. So Mary, can you give us some examples of what you're experiencing over at EvergreenHealth?
Yeah, at the all-time high, we had close to 80 patients who did not require acute care in a hospital. And just last week, we had 45 patients that could have gone to an adult family home or a skilled nursing facility that were essentially stuck. And they're stuck for a variety of reasons, whether from a guardianship reason, not enough beds, insurance authorization, all kinds of reasons. But the cost to us is caregivers needing to take care of them. It limits the amount of beds we can use for acute care patients, so often they're holding in the ED waiting for a bed upstairs because those beds are occupied. That cost is just for 1 week $1.3 million, and so it hits us both from a staffing level and a financial level every day.
Wow. Now, Beth, I know Mary had just mentioned that some of the patients are sitting down in the emergency department waiting for a bed upstairs, but how is all these extra patients taking up beds affecting other people who need care?
Yeah, so you can imagine that that is being happening in hospitals across the state. It's not just Evergreen.
Right.
So for every patient that is staying at the hospital for a long length of stay, a 60-day patient takes up the same amount of room that we could treat 20 patients.
Oh.
Yeah, and it's really impacting the ability to do regular needed services and delaying care further, which is, we saw delays earlier in the pandemic. Those are just continuing. And as Mary said, this is happening at a time where the hospitals are really financially stressed. There's not payment for many of these folks. They additionally, if they are on Medicaid, they may not be able to have someone in their family, a loved one, approve the discharge if they don't have a power of attorney for them. There's an interpretation of the guardianship law in Washington State that is really clogging up the system and could easily help get some of those patients moved to a more appropriate level of care.
So red tape.
Red
tape is what's putting this huge strain on our hospitals. What about the government? I mean, is there COVID relief funding? Is that going to be helping at all or offset the rising costs? What's the situation with that?
You know, initially, that really did provide some great relief for us. But since the Omicron and the Delta surges, we have gotten no extra payments. And on top of that, all of our costs have risen. So labor costs, I think everyone has heard about the costs of traveler nurses and adjunct staff, but it also, our supplies are raising sometimes up to 10%. There's national supply shortages, and so, you know, it's the old story of supply and demand. And so we're paying more, but our insurance rates, what we get paid by insurance companies, have not gone up. And then put that on top of Medicaid payments, haven't increased in 20 years. And so we've kind of have that perfect storm, right? We've got patients who have pent-up care, right? We have beds that are too full because they're occupied by people who don't need acute care, and then our payment is certainly not where it needs to be to make all of our hospitals financially viable.
Okay, I mean, we can't live without our doctors, our nurses, our hospitals. So what are some of the long-term, short-term solutions? I mean, are hospitals considering closing? I mean, what are we going to do?
Well, there are some hospitals that are on the verge of closing some services at the very least.
Wow.
And many of these services, as we talked about reimbursement, don't cover the cost of care. Medicaid in the state is only covering about 42% of the cost of care right now because of those long extended stays. And so people are having to look look at services like OB, very critical services in smaller areas. So this really has an opportunity potentially to really impact access to care across the state. In fact, in the first quarter, our hospitals lost $900 million. So that's significant, and we know that it's not sustainable. I mean, your home budget, you can't sustain losses over and over and over again. And we don't see any change on the horizon right at this moment.
What can we do? I mean, is it about, writing our local lawmakers to say, hey, get rid of this red tape? I mean,
definitely. We need support from lawmakers. We need advocacy for the community, and we need people to understand what's going on in their local hospitals. From a solutions perspective, we definitely need to have the increased support for those long-term care facilities. They need to have payment rates so that they can hire people and provide the care at the right place. We also do need a Medicaid increase for our hospitals, and we need changes to those guardianship law interpretation to make sure that people are able to make those decisions for their loved ones.
Thank you both so much for coming on and talking to us about this. Beth, Mary, we appreciate you. And if y'all out there are as fired up as I am right now, and you'd like to learn more about this or get in contact with Evergreen Health, just visit the website on your screen or visit New Day's website. And coming up next, we are taking the ultimate climb, more than 800 steps to support cancer research at Fred Hutch. We'll tell you how you can help too.
This portion of New Day Northwest is sponsored by EvergreenHealth.